what you'll learn.
All right. So this week we're going to conclude our lesson on the healthcare system. Um, all right, so your project is today. So if you haven't turned it in, you need to. Projects, if you are completed with it, you can turn it in this box right here. You can just sit it behind there on the floor. Make sure your summary, you can put your summary here in this tray, or you can put it, you just do it on Schoology because I put it as a discussion post. So either one is fine. This week is the end of the 9 weeks. Grades, last day for grades is to be put in, updated or whatever is Friday. I will probably be updating grades, grading projects tomorrow since majority of everybody will be at home except for 10th grade. So if you're testing tomorrow, 10th grade only comes in the building. If you're coded to 10th grade in IMAT or in power school, you should have gotten some kind of information by now if you are testing tomorrow. Um, so everybody else, 9th, 11th, 12th grade, stay at home. My suggestion will be if you got any work that you're missing for any class to get it done. Some of your teachers might give you work. For me, just make sure if you're missing stuff to get it completed. Um, so Wednesday we'll be back, regular scheduled programming. Wednesday we should finish the healthcare delivery module. Wednesday, if we're not gonna finish it today probably, but Wednesday we should be done. If you have not, you can grab a study guide from up here. I sent out a message last night because as I was checking somebody that I was grading some that were in Schoology, um, the number 25, I sent a message out for you to update that question because I had put it on there twice. Um, so make sure you update that. You can mark out what's on there already, and then I posted it on Schoology. I also sent it out and remind, so you can update that question and get the correct answer for that one. Study guides will be due Friday as well. If you want to bring it Wednesday and let me grade it, that's fine. But it'll be due Wednesday. If you do it on Schoology, you can. If you want to do it there, that's fine. If not, you'll put it in the tray. Good morning. I'm doing well. How are you? So just make sure any work, any makeup work that you need to do, you need to have it in by Friday. I know some of y'all have been quarantined. So some people are just not coming back. Any assignments that I had, that we have done in class, I put them on Schoology. Unless you say, hey, I need a paper copy or something. And I'm just gonna assume you're gonna do it on Schoology, you're gonna do it digitally. Probably Wednesday and Friday. Those of you that need to make up anything, then you can make that up as well. Remember, Friday will be your test over the health delivery system. If you do your study guide, you should be fine. 25 questions on the study guide means it's going to be 25 questions on the test. I haven't made the test yet, but when I make the test, I'm going to get a copy of the study guide. I'm going to look at it, and those are going to be the questions that's going to be on the test. So if you do your study guide, if you look at your study guide, doing it or copying somebody, not studying, actually looking at it, probably 20 minutes is all you need because we've been going over this stuff and going over this stuff and going over this stuff, so it shouldn't be that hard. Next 9 weeks, so the end of this 9 weeks is Friday. Report cards come out on the 21st, so that's next Thursday. So I think that'll be an even day. Yeah. So next 9 weeks starts next week. Um, I've accepted work, late work, just putting the grades in. But next 9 weeks, if it's late, it's gonna be docked 10 points per day. So make sure you complete it. A lot of times I give y'all time to do things in class, so it should be no reason why you can't turn stuff in when I ask for it. And I gave y'all study guide like a whole week in advance. So if you picked one up last week. All right. So our objectives for today are to explain the need for health insurance. We're going to define key health insurance terms. We're going to distinguish between individual and group insurance, describe indemnity insurance, and managed care. If you want to fill out your study guide questions as we go for this section, you can, or you can just write them on your notes. Either way. But if I tell you to write it down, it means it's probably not.
Health insurance.
All right, so healthcare is a profitable industry in the U.S. Healthcare spending makes up 3.5 trillion, or almost 18% of U.S. gross domestic product. Healthcare is one of the fastest growing sectors of the U.S. economy, showing no signs of stopping. The rising cost of healthcare is good for the economy, but the expenses are a burden for most individuals and families. So healthcare can be pricey. Health insurance helps protect individuals and families from the burden of unexpected healthcare expenses. It's a form of payment that covers the cost of certain medical expenses. The amount covered varies between insurance companies and is based on the health plan purchase. So the Patient Protection and Affordable Care Act of 2010, or ACA, was passed to reduce the number of uninsured individuals in the United States. This law had a large impact on healthcare in the United States, including requiring health insurance companies to cover children and young adults 26 years old or younger under their parents' health insurance plans, providing financial assistance to low-income individuals and families to purchase qualified health plans through health exchanges, requiring health insurance companies to provide coverage for essential health benefits, requiring health insurance companies to cover services for pre-existing conditions without charging higher premiums. So before 2010, these things wasn't a part of the U.S. healthcare. So President Barack Obama was a president that signed the Affordable Care Act into law to include these things.
Health insurance terms.
All right, so the ones I know you need to write down are premium. So the amount paid to an insurance agency for a health insurance policy is your premium. It's often a monthly payment.
Health insurance terms.
All right, so premium, need to write that one down. You also need to write deductible. So just the first sentence under deductible you need to know. So the deductible is the amount that must be paid by the patient before the insurance agency will begin to make payment. Deductibles are paid yearly. The amount of the deductible is set by the type of policy that's purchased. Some policies may have a deductible of $500 or $1,000 each year. Other policies may not require any deductible payment. So depending on your health insurance policy, you have to reach a certain amount. They use examples $500 or $1,000 in this. So say you have a policy that you have $1,000 deductible on. So every time you go to the doctor, you might pay the copayment or whatever. The insurance company will not pay for anything until you reach $1,000 for that year. So after that, they'll start paying. It might be 100%, might be 90%. It just depends on the insurance policy that you have. Copayment is an amount paid by the patient for a certain service. For example, many insurance agencies require $15 or $20 copayment for every visit to the doctor. So every time you go to the doctor, there's a fee that you would pay for that day, and that's your copay. And then co-insurance is the percentage of cost of a healthcare service that are paid by the patient after they have paid the deductible. For example, you have paid your deductible and have a $100 office visit with a co-insurance of $20. 20%. You will be responsible for $20, and the health insurance agency will pay the rest, which is $80. So once you your deductible, once you reach, say for example, your $1,000 deductible. Once you reach $1,000 on how much you've gone to the doctor and stuff, your co-payment would be 20% of the $100 office visit. So you only have to pay $20, and the health insurance company would pay $80. All right, then you have out of pocket. So a medical bill that must be paid by the patient. Many health insurance policies have a limit on the amount of out of pocket expenses to be paid by the patient each year. So sometimes insurance companies, they only allow a certain or a certain amount for each thing that you have done. They have these thing called, like, y'all probably don't notice it, but your parents or whoever, your guardian, um once you have insurance, they send what's called the explanation of benefits. And what it does is it breaks down what you had done, and it has how much your insurance company allows, and then it'll tell you how much your insurance company actually pay that doctor's visit or the doctor or whatever. So sometimes they'll cover the whole thing. Sometimes they'll only cover a portion of it. And then you have cost sharing. This discount applies to deductibles, co-payments, and co-insurance for qualified health plans. It lowers out-of-pocket expenses. Premium tax credit based on your annual income and household information. This credit lowers your monthly insurance premium on qualified health plans. You have HIPAA, that's Health Insurance Portability and Accountability Act. So it's a law that protects your health information and confidentiality. So it was signed into law in 1996. It makes it illegal to gain access to a patient's health information without their permission. It also places strict permissions on the transfer of personal health information between organizations. So with HIPAA, you can't share, like, hospitals, doctors' offices, or whatever. They can't, like, share y'all's information without written consent. You have to give consent for them to, for other people to have access to your medical records. You probably haven't noticed this either, but when you go to the doctor, usually they'll have this. Now they've gotten to where they used to give you a sheet with all these words on it, or a whole bunch of words and paragraphs on it. But now they usually might just have like a laminated copy, have you look over it, and you got to sign a paper so that you were given the Privacy Act or whatever. So that's what HIPAA is. It's protecting you. So even now, a lot of things are electronic in healthcare. A lot of patients' information is like in electronic form. You can go in. The thing is now they have different, like, tracking. I don't know if it's software or what it is, but like if you have a patient, um, say you work at a hospital, you're taking care of patients. Well, you find out your sister's cousins, aunties, brother's mother is in the hospital, and you want to be nosy and see what's wrong with them. Well, you can't just go into their chart if they're not directly assigned as your patient, because that's not your you shouldn't do it. It's not your patient. You don't need to know us. You don't need to be in their chart. Now they got it to where when you go in people's chart, it can track who's in there. It can track how long you was there. It can track what you were looking at, all those things. So people can get in trouble for, and you're not supposed to disclose information of, other people. So I can't be like, come to school and like, cameras out. I work in a hospital. I'll be like, y'all know what? I saw cameras. I see you. Like, I cannot, she got this. I can't come back and say that. That's against her privacy. So you can't, even if you know the person, you can't go to your mama and be like, I saw such and such in the hospital and this is what they got. You can get in lots of trouble for that. So that's what HIPAA does. It protects you as a patient for people getting your information without your consent. It's even to where like if people are of age, so once y'all get to be, I guess 18, and you can have your own consent, like we can't share information to your parent without you saying we can. Like people get upset about it, but it's your privacy to know, for you to know your medical record information and other people not to. We had a patient one time, he was, I think, early 20s, and he had he had HIV that progressed to full blown AIDS. All his family knew was that he was sick because we could not tell them. He didn't want us to tell them why, what was wrong, what specifically was wrong with him. We could just say that he was sick, he had pneumonia, or like we couldn't be like, okay, he has full blown AIDS. So I don't remember, because it's been a few years ago since that happened, but I don't remember if they eventually found out because he did end up dying. But I don't remember if, but we couldn't, like, he did not, before he actually got like placed on a ventilator and got like when he couldn't talk for himself, he made it very clear that we not tell his mom or his family like what exactly he had going on. So, and we couldn't do it.
Healthcare fraud.
All right, so another important term regarding health insurance is healthcare fraud. Healthcare fraud is a crime anytime a provider, employee, or patient intentionally submits false or misleading health information for use in determining reimbursement. They are committing fraud. Examples of healthcare fraud include using someone's health information as if it were your own, billing for medical services that were not provided, delivering unnecessary medical services, misrepresenting the nature of medical services provided to obtain higher reimbursement, providing or receiving money for participating in any of the fraud schemes listed above. So like some people, you see doctors that get in trouble. It was somebody here locally a couple of years ago that was writing prescriptions for people that didn't really have like, you know, whatever the prescription was calling for. That's healthcare fraud, using other people's information to get medicine. Because people like narcotics and they like strong stuff, and so sometimes you can find somebody that'll write prescriptions, but usually it always comes back some kind of way, and people get in trouble for it. So, and then also making sure you look at, like, when y'all do get like y'all statements from doctors' offices or hospitals, making sure you look and see what they're billing you for, because they do make mistakes. I found stuff that they bill for that didn't actually happen before, because it could be something you having to pay for that you didn't even have. So just make sure you're paying attention to stuff like that. A deductible is paid on a yearly basis.
Yes.
True. What is a health insurance premium?
Amount.
So it's the amount paid to an insurance agency for an insurance policy. Okay. What is co-insurance? Anybody want to give? All right, it's a percentage paid to the doctor after your deductible has been paid.
Health insurance, then.
All right, so first broad coverage health insurance took the form of workers' compensation. It was introduced in 1914. This coverage provided cash payments to injured workers with job-related injuries or illnesses. Compensation for medical expenses was later added, leading the way to the growth of private health insurance. Major medical insurance became widely available in the 1950s. Originally, these plans were designed to protect families from financial hardships that might occur as a result of hospitalizations, extended illnesses, and expensive surgery. Health coverage has since expanded to include routine care. The Affordable Care Act of 2010 requires health insurance companies to cover 10 essential health benefits. So, you need to know this sentence. The Affordable Care Act of 2010 requires health insurance companies to cover 10 essential benefits. You don't have to write the benefits down. Just know that that is what the ACA covers. All right, so these benefits are outpatient care, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance abuse treatment, prescription drugs, rehab and rehabilitative services and devices to help people with injuries or disabilities, lab services, preventative health services, pediatric services, including vision and dental, not essential for adults per the ACA. So these are things that are covered under the Affordable Care Act of 2010. So that was the question that I replaced on number 25. I think it said what requires health insurance companies to cover 10 essential health benefits. That would be Affordable Care Act.
Individual and group insurance.
All right, so private health insurance policies may be purchased in two basic forms. They may be in individual or group. Individual is when a person purchases a policy and agrees to pay the entire premium for health coverage. People with individual health insurance are typically early retirees, they're self-employed individuals, and employees of small businesses that do not offer health insurance. About 7% of the U.S. population is covered by an individual health insurance plan. Then you have group insurance. That's when a policy is purchased through association with a larger organization such as an employer, union, or professional organization. For people with private health insurance, coverage obtained through an employer is the most common. The premium is split between the employer and the person being insured. Group insurance is almost always less expensive than individual insurance. Medical insurance is an important benefit of employment. When health insurance benefits are purchased through an employer, they are generally cheaper than an individual plan. Additionally, the premiums that are paid are not subject to income tax. So for group insurance, that's usually like if you have a job, like here at the school system, we have group insurance that we pay like monthly. if you don't work full time, you're retired, you have your own business, then you will probably have to do like the individual insurance, which at times could be more expensive than group. And which type of insurance policy does the person being insured pay the entire premium? All right. Which type of insurance policy is a premium split between an employer and the person being insured? Medical insurance is an important benefit of employment. And some people get jobs, or, you know, if they have a spouse or somebody that needs insurance, they'll get a job to just for the insurance, because trying to have a medical condition and not have insurance is very
In the early years of health insurance,
expensive. Even with insurance, somebody with a medical condition that you have to have medicine that you take all the time, or you have to go to the doctor a lot, it can get very expensive. All right, so indemnity insurance. In the early years of health insurance, most policies were in the form of an indemnity policy. With indemnity insurance, patients must pay for all healthcare expenses out of their own pockets. Afterward, the insurance agency will reimburse the patient for the expenses. In some indemnity policies, the total expense will be reimbursed. However, most indemnity policies reimburse only a percentage of the total expense. A typical amount for reimbursement is 80%. Patients can obtain healthcare services anywhere from any provider. Indemnity insurance does not work for everyone. Some people cannot afford to pay for their medical expenses out of pocket and then wait for reimbursement. As a result, a new type of medical insurance known as managed care became popular in the 1970s. All right, so for indemnity insurance, you just need to know that patients pay out of pocket and then they get reimbursed. So for indemnity insurance, patients pay out of pocket and then they get reimbursed. So they'll pay for it up front, and then the the insurance agency will give them the money back. Or it'll be a percentage. It might not be the whole thing.
What's your name so I know to look for it? Okay. All right, I believe you too. I believe you. I'm ready to do it. Good morning. Good morning, Miss Harry. You have 10th graders?
Yes.
Quick announcement. 10th graders, please check your email for a message from Mr. Hillary. Okay. Please know what your grade level is. If you Joan, please ask your teacher what your grade level is. This is in the computer. You can dress comfortably, stay within dress code. Girls, do not wear those stretchy pants, those exercise things that you wear, flip flops, slides, or house shoes. Don't wear any of that stuff. Dress comfortably, stay within dress code. Thank you.
You're welcome. No, not while I'm teaching. Does everybody know what grade they in? In the computer, y'all know what grade y'all in? No, you don't know what grade you're in? Okay, I'll have to look for you. So make sure y'all look. I guess your email might tell you where you're testing or some instructions for tomorrow if you're in 10th grade.
Managed care.
Alright, so managed care is built on two primary concepts: promoting good health and practicing preventative medicine. The goal is to reduce the cost of medical expenses by maintaining a healthy lifestyle. Managed care plans offer medical services through a system of healthcare providers called a network. The system of providers offer services at reduced rates. People who are insured through a managed care plan must receive treatment from physicians within this system in order to get the reduced cost.
Managed care versus.
Alright, so there are two major differences between managed care and indemnity insurance. The first difference is payment. With indemnity plans, patients will have a greater financial responsibility, so they must pay for services out of pocket and then wait for reimbursement from the insurance company. Most managed care plans, the insurance company will pay the healthcare provider directly for the medical services. However, in both types of insurance, the patient may be required to pay the yearly deductible. The second major difference between managed care and indemnity insurance is choosing a healthcare provider. Most managed care plans require patients to choose from a network of healthcare providers. If a patient receives treatment from an out-of-network provider, the insurance company may not cover the medical expenses. In indemnity plans, there are no networks. Patients may receive treatment from any healthcare provider. With indemnity insurance, patients are reimbursed for medical expenses after out-of-pocket payments are made. What is the goal of managed care insurance? Nobody? For what? This one? The person? Why don't you saying medical? To reduce medical expenses by maintaining healthy lifestyles.
Reimbursement.
Alright, so reimbursement is when health insurance repays what the patient has paid out of pocket. Health insurance plans do not always reimburse the full amount charged for services. Physicians may charge any amount for the services they provide. However, insurance plans may have a set limit for the amount that they will reimburse for that service. So, for example, a doctor may choose to charge $200 for a routine checkup. However, an insurance plan may have an allowed amount of $150 for a routine checkup. The remaining $50 may be covered in one of two ways. The doctor will absorb the loss. This means that the doctor will drop the $50 charge and accept $150 from the insurance plan as full payment for the checkup. Or two, the doctor will charge the patient for the remaining $50. In this way, the doctor will receive the full $200 payment for the checkup. This is called balance billing. Preferred or in-network providers are not permitted to balance bill patients. Patients need to be proactive with their health care and insurance. They must ask questions and research reimbursement amounts. Health insurance plans send patients an explanation of benefits that explains how a medical claim was paid and will indicate whether there is any remaining amount the provider may bill directly to the patient. So that's what I was talking about earlier. Doctors may charge any amount for services they provide. Insurance agencies must reimburse doctors for the full amount that was charged to the patient. All right. They don't have to. It's usually just an allowed amount. All right. So, what is the amount paid to an insurance agency for a health insurance policy? A higher premium and a higher copayment. Amount that must be paid yearly by the patient before the insurance agency will begin making payments. An amount paid by the patient for a specific service, such as paying $50 for each doctor visit. A medical expense that must be paid by the patient. Patients pay for healthcare expenses out of pocket. Afterward, the insurance agency will reimburse the patient. And then managed care.
Lesson summary. In this lesson,
Didn't you go to the bathroom now?
what you'll learn.
You can go to the bathroom now. Alright. We're gonna do like a little bit of this one today, and then we're gonna save it for the rest of it for the next time. Alright, so compare the features of EPO, HMO, PPO, and POS plans. Evaluate the total cost healthcare related to choosing a health plan.
Managed care.
Alright, so most plans in the United States are managed care plans. Managed care offers reduced rates for medical services through a network of healthcare providers. There are several types of managed care plans. Most common are HMOs, or health maintenance organizations, PPOs, preferred provider organizations, EPOs, exclusive provider organizations, or point of service, or POS.
Health maintenance organizations.
HMOs are a common type of managed care. In an HMO, the person being insured pays a monthly fee or premium. After the person has paid the deductible or copayment, medical services are provided by a network of providers that contract with the health plan. If the person receives medical services from a provider that is not in the network, the HMO will not cover the expenses. Many HMOs also require the insured person to select one primary care provider, or PCP. The person must visit the selected provider for all checkups and procedures. If the person needs to see a specialist, they must get a referral from their primary care provider first. However, if the person is in an emergency situation, pre-approval is not required. HMO provider networks are local. Sometimes an HMO will contract with independent practice associations, or IPAs, rather than with individual providers or group practices. An IPA represents a large number of healthcare providers. This keeps the HMO from having to establish contracts with each individual provider. Many HMOs require the insured person to select one primary care provider.
A preferred provider organization.
Alright, so now you got a PPO, or preferred provider organization. The insured person can get medical care from both in-network and out-of-network providers. If you choose an out-of-network provider, you may have higher out-of-pocket expenses. For example, services in an in-network physician may be covered at 100% after deductible and copayment, but services from a non-network physician may only be covered at 80% after deductible and copayment. This means that a person receiving care from a non-network physician must pay the remaining 20% of expenses out of pocket. PPO plans do not require you to select a PCP. Since you do not have to select a PCP, a referral for a specialist is not required. PPO plans also provide access to out-of-state providers that are considered in-network. So you need to know that PPO plans do not require you to select a PCP. PCP is primary care physician or provider, because it could be like not necessarily a doctor, but it could be like a nurse practitioner, physician's assistant, somebody like that. So PPO plans do not require you to select a PCP. PPOs require the insured person to choose one primary care physician. A person who receives medical insurance from a PPO may receive treatment from a non-network physician.
Exclusive provider organizations.
EPOs, or exclusive provider organizations, are managed care plans where coverage for healthcare services is limited to care from providers or hospitals in the plan's network, except in the case of an emergency. As with the PPO, referrals are not required to see specialists. However, like HMOs, EPOs do not provide coverage for care from an out-of-network provider.
Point of service. In
a point of service plan, or POS, you are required to select a primary care provider and will need a referral from your PCP to see specialists. As with a PPO, you will have access to out-of-network providers at an increased cost. In a POS plan, the insured person needs a referral from the in-network PCP to see a specialist.
managed care comparisons.
All right, so this is just a chart to see like the different plan types. So you have your HMO, PPO, EPO, POS. If you have to have a primary care physician, you have to have a referral, and does it cover anything out of network? All right. So insured person must receive medical treatment from a specific network of healthcare providers. Which one is that? I should guess.
PPO.
You said PPO? Insured person may choose between in-network or non-network healthcare providers. Insured person must select an in-network primary care provider and will need a referral from the PCP to see specialists. Insured person must use providers and hospitals that are in-network except in the case of an emergency. Got all of them. So you got two that you have to be in network, and two that you don't have to be in network. What's she saying? Y'all throw something out there.
EPO can be the bottom one.
So I'm gonna give you a hint. PPO, you don't have to be in network.
HMO.
So I said PPO, you don't have to be in network. So these two have to be in network. HMO and EPO can be out of network, or PPO and POS.
Rita and Marcus.
All right. So here's an example. So Rita found out a few weeks ago that she is pregnant. She and her husband Marcus are very happy. They will visit the doctor approximately 10 times during the next 9 months. In addition, they expect a hospital bill of about $5,000. Assume that the premium for each plan is the same and that Rita and Marcus plan to visit an in-network physician. Which plan has the lowest out-of-pocket cost for Rita and Marcus? So for HMO plan, they need to pay $10 copay for each doctor visit. Their deductible is $750. Since Rita and Marcus have not needed any medical care this year, they must pay the entire deductible. After the deductible is paid, the HMO will cover 100% of the remaining hospital expenses. For the PPO plan, it includes a $20 copayment for each doctor visit. PPO plan also requires a $100 copayment for Rita's hospital stay when she delivers the baby. Rita and Marcus must also pay a $500 deductible. All other hospital expenses will be covered by the PPO at 100%. EPO plan has a $15 copayment. There is a $1,000 deductible that applies only to hospital stays. After the deductible, the EPO will cover 80% of hospital expenses. POS, the copayment for each doctor visit is $10. There's no deductible for the POS plan. All hospital expenses will be covered by the POS at 90%. So, you see, they're gonna have 10 visits, $5,000 gonna be the bill, and it needs to be in network.
Evaluating the plans.
All right, so out-of-pocket cost for Rita and Marcus depends on the coverage of the insurance plan that they have. They will visit the doctor 10 times during the pregnancy. Also remember that hospital expenses will be $5,000. So for the HMO
plan.
copayment is
The
$10
copayment is $10
per doctor visit. With $10 with 10 visits to the doctor, Rita and Marcus will pay $100 in copayment. Deductible is another $750. All other expenses will be covered by the HMO at 100%. Therefore, the out-of-pocket cost for the HMO plan is $850. For the PPO plan, copayment for each doctor visit is $20. With 10 doctor visits, Rita and Marcus will pay $200 in copayment. The copayment for the hospital stay is another $100. The deductible is an additional $500. All other expenses will be covered by the PPO at 100%. Therefore, the out-of-pocket cost for the PPO plan is $800. For the EPO plan, copayment is $15, 10 doctor visits. They'll pay $150 in copayment. EPO has a $1,000 deductible that will be applied to the $5,000 hospital bill. This leaves $4,000, of which 80% will be covered by the plan. 80% of $4,000 is $3,200. Rita and Marcus will be responsible for paying the remaining $800. Therefore, the out-of-pocket cost for the EPO plan is $950. So that's their co-payments plus the $800 that's left over. And then the POS plan, the co-payment for each doctor visit is $10. With 10 doctor's visits, they'll pay $100 in co-payment. There is no deductible. It will cover 90% of the $5,000 hospital bill. 90% of $5,000 is $4,500. Rita and Marcus must pay the remaining $500. Therefore, the out-of-pocket cost for the POS plan is $600. The POS plan offers coverage at only 90%. However, the POS plan also has no deductible. This means that for Marcus and Rita's situation, the POS plan has a large out-of-pocket cost. So because the reason why this is so is because they don't go to the doctor. So they haven't used any of their they wouldn't have met their deductible. And because POS doesn't have a deductible, it's gonna be the cheaper.
Tyrone.
All right, Tyrone is single, in his 30s. He's active, healthy, but today he's sick and needs to see his doctor. Assume that the premium for each plan is the same and that Tyrone will visit an out-of-network provider for his sick visit. The charge for the sick visit is $150, and Tyrone has not yet met his deductible for the year. Which plan has the lowest out-of-pocket cost for Tyrone? So for the HMO plan, sick visits are a $40 copay for in-network. There is no out-of-network coverage. So it says up here that he will visit out of network. So the deductible for the plan is $500. After the deductible has been paid, all in-network expenses are covered at 90%. PPO plan, co-payments for doctor visits are $20 for in-network, $40 for out-of-network providers. The deductible for the plan is $250. After the deductible has been paid, expenses are covered at 90%. For EPO, there is no out-of-network coverage except in the cases of emergency. For POS, co-payments for doctor visits are $10 for in-network, $20 for out-of-network. The POS plan has no deductible.
Evaluating the plans.
All right, so with Tyrone, daughter's appointment is $150, and he has not yet met his deductible. So that means the insurance company is not going to cover all of it. For the HMO plan, HMO plans do not have out-of-network coverage. Since Tyrone plans to see an out-of-network provider, he will be responsible for the full charge. So for PPO, co-payments for out-of-network visits are $40. Deductible is $250. All other expenses are covered at 90%. Because he has not yet met his deductible, his out-of-pocket cost is a full charge of $150. For EPO plan, do not have out-of-pocket network coverage, and of course he said he wanted to do an out-network provider. He will be responsible for the full charge. So POS plan, co-payments for out-of-network doctor visits are $20. There's no deductible. Tyrone must pay his $20 co-payment. So HMO and EPO plans do not have out-of-network coverage, so Tyrone will be responsible for the full charge of his doctor visit. He'd also be responsible for the full charge with the PPO plan because he has not met his deductible for the year. POS plan does not have a deductible and has out-of-network coverage, so Tyrone will only be responsible for his $20 co-payment. For Tyrone's situation, the POS plan provides the lowest out-of-pocket cost. Well, this works for Tyrone because Tyrone is not sickly. He doesn't go to the doctor a lot. But if something changes with his situation, POS plan might not be the one for him.
Michael.
Okay. So Michael is in his early 50s. He's experienced some heart problems. After he goes to see his family doctor, he goes to see a cardiologist. Cardiologist is somebody that specializes in the heart. So he goes to an out-of-network cardiologist 4 times a year to monitor his heart condition. Each time he goes is $150. Michael's heart tests and treatments are $6,000 per year. Assume that the premium for each plan is the same. Which plan has the lowest out-of-pocket cost for Michael? So for HMO, co-payments are $10 if it's in network. It's not covered out of network. Deductible is $750. PPO plan co-payments are $15 for in network and $30 for out of network. Deductible is $500. After that deductible has been met, it'll be covered at 100%. Your EPO plan co-payments are $15 for in-network. Remember, out-of-network are not covered unless it's an emergency situation. The deductible is $750. After the deductible has been met, anything else will be covered at 90%. Then you have POS co-payments for doctor visits are $40 in-network and $20 in-network and $40 for out-of-network. It has no deductible, and after the $40 or $20 co-payment, everything is covered at 90%.
Evaluating the plans.
All right, so of course his out-of-pocket cost depends on which one that he chooses. He goes to the cardiologist 4 times a year, and remember that his expenses for his tests and treatments are $6,000 per year. So HMO does not have out-of-network coverage, so he wants to see so his cardiologist is out-of-network. All of his expenses will be out-of-pocket. So his out-of-pocket cost would be $6,600. Co-payments for doctor visits are $30. 4 visits a year, he will pay $120 in co-payments. The deductible is another $500. All other expenses are covered at 100%. So his out-of-pocket cost will be $620. EPO does not have out-of-network, but we know his cardiologist is out-of-network. So out-of-pocket, he'll be $6,600. And then for the POS plan, co-payments for doctor visits are $40. He'll go 4 times a year. That'll be $160 in co-payments. There's no deductible. The POS will cover 90% of all other expenses. 90% of 6,000 is 5,400. He must pay the remaining 600. Therefore, the out-of-pocket cost for the POS plan is $760. But because Michael sees an out-of-network cardiologist, PPO has the lowest out-of-pocket cost.
Making informed decisions.
Hold on, I'm almost done. HMOs, PPOs, EPOs, and POS plans provide medical coverage that is suitable in most cases. The most cost-effective plan depends on individual's healthcare need and the coverage included in the specific plan. Even within the same type of managed care plan, the cost of the insured individual can vary. Anyone who buys health insurance should research and compare the type of plans that are available. Likewise, people who know in advance that they will need extensive health care should research prices for the expected care. This will enable each person to predict the out-of-pocket costs, if any, based on the health plan. It's important to make informed decisions about health care.